In this video, we're covering one of our telehealth assessment tools that we use to indicate that there's sciatic nerve involvement or nerve root involvement associated to someone's back or SI joint pain. Now, what we can do is go into a long sit position here, and keep in mind this is only one of the tests that we do. We use a lot of them to confirm this. And so in a long sit position here, we have them actually bring their toes up towards their face, 2 at a time, 1 at a time, 1 at a time, without letting the knees raise like I did that first time. So what we may find out is actually 2 feet up creates their issue, 1 foot or the other foot, okay? If this is not really getting there, you can pre-tension it a little bit more, putting the hands on the floor, and then do the test as well. What we don't want to do is keep provoking it, but if we find out that the foot changes the back, hip, or hamstring conditions, that we know that there's possibly nerve root involvement, and it changes how we manage it a little bit. So we need to actually perform other orthopedics testing, take a good history, and then possibly image it to figure out a confirmed diagnosis. That helps us out to identify how to manage it as well. So if you guys want help virtually or in person, reach out to us.